Welcome to X-ray interpretation for anesthesia. My name is Sandra Hurst, and I'm pleased to be your instructor in this course. I will be giving you a brief overview of what will be covered in this module. Before we start any X-ray analysis, there's some foundational data that needs to be addressed. The patient on the X-ray needs to be identified. The name should be clearly stated. The date the X-ray was taken is extremely important. You need to be treating current issues. The age of the patient is another identifier, as is a brief history of the reason the X-ray was taken. These details are important. You don't want to be putting a chest tube in a pneumothorax that resolved last week. The quality of the X-ray needs to be evaluated. Rotation needs to be checked. Evaluation of adequate inspiration, the position of the patient at the time of the X-ray, along with the assessment of the correct exposure. There's a mnemonic you can use to remember these very important assessments. RIPE, R-I-P-E. This course will cover chest anatomy, gross anatomy of the heart, and its position in the thorax will be identified. The details of the location of the heart structures and their corresponding location on X-ray will be determined. Anatomy of the lungs will be visually noted, and then the integration and appearance on X-ray will be clearly discussed and identified. The A, B, C, D, E method of chest X-ray analysis will be presented to ensure a consistent, systemic analysis of all components. A stands for airway and will address the appearance and location of the trachea, carina, and major bronchi. B stands for breathing, which will address the actual lung fields. C stands for cardiac, which will identify and evaluate the heart and mediastinum. And D will address the appearance of the diaphragm. Finally, E will address evaluating the rest of the structures, everything else, bones, soft tissue, lines, and tube placements. There are several variations of evaluating chest X-rays, but this method will ensure that important findings are not missed. This module will discuss the appearance of several commonly found pathologies. You will compare and contrast the normal from the abnormal findings on chest X-ray. The clinical implications will be expanded from case studies that will be presented. The anesthetic considerations include the COA's recent changes in their educational standards, which now require that all SRNAs have both clinical and didactic experience in chest X-ray analysis. They specifically mention the importance of the immediate peri-anesthetic implications, pneumothorax, pulmonary edema, and also verification of tube placement, endotracheal tube, chest tube, vascular access, and gastric tube. At the conclusion of this module, You will be confidently able to evaluate chest X-rays and their anesthetic implications. Wishing you success in your learning. If you have any questions about this module, you can contact me by email or phone. Good luck.